Hi, this is Dr. David Wade. I wanted to speak to you a minute about some good news related to fibromyalgia. You know, there's as many as 18 million Americans that suffer from fibromyalgia. It's a very misunderstood disorder that causes chronic widespread pain and hypersensitivity to any kind of pressure. It affects also go far beyond pain to symptoms like fatigue, sleeplessness, difficulty in concentration, bladder and bowel problems, and many other types of related conditions. Many types of fibromyalgia problems can become disabling. The name fibromyalgia comes from the Latin and Greek word. The root word is fibro, which means fibrous tissues, and myo, which means muscle, and algos, which means pain. So fibros, myo, algos means fibrotic scar tissue within the myo, the muscle, and it creates the algia, which is the pain, fibromyalgia. Now, the meaning basically is muscle and connective tissue pain. The name is thought to be a misnomer. Originally, it was described what was thought to be fibrous deposits in the muscles that cause the pain. While it's true that some patients actually do have muscle spasms so severe that they become fibrotic, it has really nothing to do with the causes of fibromyalgia. In the past, fibromyalgia patients were often called hypochondriacs. Doctors really didn't understand the problem. They were referred to psychiatrists, and it wasn't uncommon for people suffering from fibromyalgia to be institutionalized, if you can imagine, simply because the doctors really didn't understand what fibromyalgia was. Only recently has fibromyalgia gained recognition as a condition that deserves attention. In general, patients are receiving more respect today and are believed when they say they have a problem. But they might still be looked upon as drug addicts because most of the time the doctors are simply giving pain medication for the problem instead of addressing the sources of the imbalances and the problems that are associated with. Many people are presumed to be self-serving motive, and when really all they want is just to get somebody to believe them that they got a problem and that they're trying to get some help. Researchers estimate that fibromyalgia affects up to 6% of the population, with about 9 out of 10 sufferers being women. So women are much more frequent in developing. Many medical practitioners really do not know the cause of fibromyalgia, and there's increasing amount of research over the past 30 or so years, but there's little agreement on what fibromyalgia actually is and what to do about it. Many times you end up now being sent to rheumatologists who deal with autoimmune disorders and connective tissue disorders that are related to with individuals. Unfortunately, that's not really always the best end result because, again, you're still treated with medication instead of addressing the sources of the imbalance. Aside from the pressure tests, which are themselves somewhat disputed, there are really no generally accepted objective tests for fibromyalgia. And in the end, most patients are diagnosed based upon a pattern of symptoms and differentials. That is, the doctor reviews the history of symptoms and rules out better known possibilities before determining that fibromyalgia may be actually the best description for the problem. Since the cause is unknown, there's no generally accepted treatment for fibromyalgia itself. Instead, doctors typically focus on relieving the symptoms, and they do that through a variety of medications, therapies, and lifestyle changes. Many doctors, in fact, question the existence of fibromyalgia as a distinct clinical entity. The failure of the medical profession to agree on the cause, to agree on the treatment, or even the existence of fibromyalgia has made it very difficult for people suffering from this painful and debilitating symptoms to find any kind of answer. We have created a neurological relief care center in our office, and we take a much broader view of fibromyalgia. We believe that fibromyalgia and other conditions are actually caused by a compression of the meninges, which is the covering around the spinal cord, and as a result of the senses and the sensitivity builds up the three-layered membrane that protects the central nervous system. And our team has created a neurological relief center technique, which is a treatment procedure for neurological disorders, including fibromyalgia symptoms and other types of neuropathies. An initial neurological relief center test can bring temporary relief and quickly determine if the long-term treatment will actually benefit you as a patient. Many symptoms are associated with fibromyalgia: chronic widespread pain, painful hypersensitivity to pressure, tingling in your skin, numbness, muscle spasms, weakness in the limbs, insomnia or sleep pattern disturbances, cognitive disorders, which sometimes they call it fibro fog or brain fog, difficulty concentrating, memory problems, decreased attention and ability to multitask, anxiety, depression, irritability, nervousness, chronic localized pain, including shoulder pain, neck pain, back pain, and hip pain, rashes, and there are some other conditions that are common among sufferers, including chronic pain of the facial muscles, pins and needle feeling of the skin, the fibromyalgia condition itself, irritable bowel syndrome, bladder and urinary problems, skin disorders, headaches and migraines, muscle spasms, hypoglycemia, which is low blood sugar, rheumatoid arthritis, lupus, post-strokes type symptoms, MS type symptoms, reflex sympathetic dystrophy type symptoms. I'm telling you, it's a very complicated problem, and with all those symptoms that I've just listed and the conditions that are sometimes associated with fibromyalgia, it becomes an extremely difficult problem. But fortunately, we have the ability to assess and evaluate and determine the exact cause of the problem, and the ability to be able to address things that might be able to help you. This is Dr. David Wade. I'm looking forward to meeting you and wishing you good health for a lifetime.